Hey everyone, it's Nurse Dani. Each week I respond to your questions with either a written or video response, and here are answers to some of the questions you asked during the week. Many parents who are anticipating the delivery of a baby boy talk about circumcision. It comes up and they think about, should we circumcise him or not? And there are people who circumcise because of religious reasons. There's others who circumcise for cultural reasons. There's others who don't for cultural reasons. Or sometimes it just comes down to personal preference. And whatever you choose for your son is just fine. The topic of circumcision has been studied extensively, and the American Academy of Pediatrics has come out with a statement that says that there are some medical benefits in favor of circumcision. These include slightly lower rates of urinary tract infections, sexually transmitted infections, and cancers later in life. So if you're thinking about circumcising your son, talk with your pediatrician about it, and it's usually done in the hospital before you go home or a couple of weeks later in the doctor's office, and they'll be able to give you more details about the types of anesthetic used for the procedure as well as how it's done. You asked a question about mixing water and juice together in order to get your son to drink water because he won't drink it any other way, and you want to know if that's okay or not. And the first issue is how old your son is. If he's less than a year, he doesn't need to be drinking water or juice. The main form of hydration for a baby less than a year should be formula or breast milk. And then after a year, then it's okay to give up to 4 to 6 ounces of juice per day. But most pediatricians say that juice isn't necessary because it increases your child's caloric intake without getting much nutrition out of it. But if you do give it, make sure it's 100% juice, and it is always best to give it in a cup, not a bottle. Because if your baby or your child is constantly sucking on juice or just drinking it throughout the day in between meals, then it definitely increases the chances of them having cavities. And so the practice of putting juice in the water to get your son to drink water probably should be avoided. But if you have more questions about it, especially if you're worried about your son's hydration status, talk with your pediatrician. Do encourage water in between meals and milk with meals. Your son should be drinking 2 to 3 cups of whole milk each day if he's between the ages of 1 and 2. Then after that, you can give 1% milk. And this does have a lot of nutrition in it. When compared to juice, it has vitamin D. It has healthy fat that your child needs at that stage in life in order to develop and grow. So milk with meals, water in between. You mentioned that you have a baby boy that gets an extremely dry nose at night, and you feel like that's what's waking him up and causing him to cry. And it could just be the fact that the humidity is very low in your house or in your area. And by putting a cool mist vaporizer in his room, it will moisten the air, and it could help the problem. If you feel like he's congested because he's got secretions in his nose, you can put 2 to 3 drops of saline in there, each nostril. Wait for 30 to 60 seconds, and that's when all the magic happens. It loosens everything, and then suck everything out with a bulb syringe. But don't do this more than 2 to 3 times a day because that can actually irritate the lining of your baby's nose and cause more problems. But if you just do it on occasion, then that's okay, and it can actually help him breathe a lot better and feel better. Another thing to consider is that it's just normal for babies to wake up during the night, and they need to learn how to self-soothe. But sleep training or teaching a baby how to fall back to sleep on their own shouldn't be done until the baby is old enough and your pediatrician has given you the green light. In the early months of life, a baby needs to eat frequently, and a mother should respond to the baby's needs and attend to them when they wake up at night. But as they get older and the pediatrician says that your baby doesn't need extra nighttime feedings, then you can teach your baby to self-soothe by either crying it out or by doing a more graduated approach where you just incrementally check on your baby, reassure them that you're there, but then turn around and walk right back out of the room. So your baby's nighttime wakings might just be normal. It might not have anything to do with the fact that his nose is dry, but it is worth trying a cool mist vaporizer and seeing if that makes a difference. If you have more concerns about it or you notice other concerning signs, talk with your pediatrician and they'll be able to give you the best advice based on their ability to actually check out your baby, ask you more questions, and then decide if anything needs to be done about it. I hope you found these tips helpful, and if you have more questions in the future ranging from preconception to pediatric and women's health, be sure to like this video, like our Facebook page, and subscribe to our YouTube channel by clicking on the link above.